Welcome to the High Value Sales Show of Eversprint.com. I'm Malcolm Louie, the managing member of Eversprint, and today we're speaking with Paresh Shah, the president of MindLeaf Technologies, a provider of compliance and revenue cycle solutions to healthcare organizations nationwide. Welcome to the show, Paresh.
Yeah, thank you. Nice being here.
Paresh, you grew your company's revenue from $6.8 million in 2014 to $10.7 million in 2017, a 59% increase. And in 2018, you hit around $7.2 million. Before we talk about how you grew your company so rapidly over the 2014 to 2017 time period, can you briefly share what your company does beyond my quick intro and how your company differs from the competition?
Yeah, hi. Thanks a lot, Malcolm. Okay, glad to be here. At MindLeaf, what we do is we provide medical support, revenue cycle, and compliance services to the providers. That is the physicians, the hospitals, the treatment facilities, and the clinics. We strictly work with the provider community, and we also work with large physician groups. How we differ, we don't provide staffing, we provide much more than that. For example, if we have to do medical coding, we provide the process based on how the standards are required, the compliance is required. We tailor the processes to the particular facilities. Our staff get totally trained, and then we implement the solution. So we just don't go out quick and dirty and get out. We stay there for 1 year, 2 years, make sure that the processes are clean and they're fully compliant and fully in support of the regulations, the revenue cycle, and all the compliance parameters which are there. And that's how we differ from the competition.
All right. And when you grew your company from 6.8 million in 2014 to 10.7 million in 2017, what were the three biggest drivers of your sales growth during that time period?
The couple of things. Healthcare is kind of a different kind of animal. It is a very regulated industry for the providers because they have so many regulations, got to worry about HIPAA, got to worry about codings, got to worry about MEPS, MECRA, and then to complicate the effort, they have electronic medical records, which creates a lot of documentation and everything. So understanding the physician piece, understanding how the hospital works, because every physician is different. Every department within a hospital is different, like internal medicine works differently than a cardiology as well as to neurology. And then every hospital works differently. And then you complicate that hospital, how they're competing against the other hospitals. So you got to start at the ground roots level. And that's what we differ, and that's what our biggest drivers of growth is. We understand how the workflow is at the roots level, and then we can expand at the department, at the hospital, at the clinic, at the hospital level, and then at the independent networks level. And that was the biggest drivers of our growth. We don't go top to bottom. We start from bottom and try to go up.
All right. So the biggest driver was starting at the bottom, totally understanding the workflow, and then expanding your influence, I suppose, learning more about how they do their workflows and expanding from there.
Sure.
All right. How about drivers number 2 and number 3?
That's the number one. That's the biggest driver. The second thing is to have we always understand, we have two sets of clients, the non-government and the government clients. Okay. We understand what the requirements are right from day one. What are the things to look for? What are the chief criteria? You got to have, everybody talks about we have a great management skills. That is great, but what the management skills are supposed to do? What is their job? Is it to worry about the contracts, or is it to worry about the project management? So that's the second thing what we look for is do we cater to what the customer requires, or once we are there, we try to give them different solutions? No, we totally stick to what we know. Okay. If the contract or requirement is to do XYZ, we will only work on XYZ. Once we finish XYZ, then we start exploring, hey, we did XYZ, but these are the additional areas you can take advantage. So we stick to project management, cost control, our staffing, our recruiting, HR, where we can recruit in all 50 states. all over the country because we have a very powerful HR engine, okay, HR platform. And the final thing, that was number two, is all the management skills, the process, HR, cost control, project management. The final thing, the biggest driver of our growth is having a good set of processes in place internally. Okay, you may have all those great things, but the most important things is how is your internal growth of the company is. For example, what kind of a stuff you have internally. We use automate little bit of automation internally. We have a nice HR system, candidate selection system, okay, and then we also have a very good accounting system, and now we are trying to augment ourselves by getting a better accounting systems and doing all those business analytics. Okay. Does that answer your question, Malcolm?
Yeah, it does. So I guess the key to your really rapid growth is being able to manage it, right?
The management and the process associated, and then the internal process.
Right. All right. Got it. Now, your revenue took a bit of a dip from 2017 to 2018, from 10.7 million down to 7.2 million. What happened there?
Oh, simple. I mean, we had a lot of government contracts. We just got pushed back. So instead of starting on day one, it's got started in 90 or 140 plus days. Okay. And that was the main reason. And because of that, a couple of them did not even get started till this year. So so last year was a transition year. This year is going to be a little bit transition, but beginning next year, we should be back to $12 to $15 million range.
All right. Now, does that happen often with government contracts?
It doesn't happen, but it just happened in our case.
Okay.
I mean, it does happen often, but it's it happens 8 out of 10, but we would happen to be, it happens 2 out of 10, not 8 out of 10, 2 out of 10 times. But this time we were one of those unlucky ones.
Right. Yeah, so that sounds like the government side of your business is quite substantial then.
Yep, it is a substantial, and we also are getting into new areas which is outside the government.
Okay. What percentage of your revenue right now is on the government side?
The goal is until now it was started at 90, 95, 100%, slowly reducing it. By the end of this year, we plan to be 80-20, 80 government, 20 non-government. Next year could be 70-30. The goal is to make it 60-40 or 50-55-45.
Okay. When do you think you'll hit that target?
The goal is to hit that target in 2021.
Right. Yeah, it's from my other conversations with other C-suite folks, right? I mean, working for the government's fantastic because the contracts can be big and steady, but then it's also kind of a double-edged sword, right? Because things can happen and you can lose the contract or you get deferred and then you're kind of left hanging.
Yep. That's part of the equation. You could be able to weather the storm. Okay. You got to have the processes, you got to have the management, you got to have the finance, and you got to have the internal processes to weather the storm. This is doesn't happen. I'll give you an example. We had a government shutdown in December and January. What can you do? You're not going to get paid. You can't lay off the employees. Mm-hmm. So you have to still pay that. But those are part of the equation.
Yep. Yeah. For one of my previous interviews that I had, they talk about the importance of winning the rebids. How does that work for you in terms of?
We've been successful so far because don't forget the government healthcare is changing. They were on a different electronic system, and now they're moving to Cerner, electronic medical records. Everything is changing along with that, and you got to change along with that.
Right.
Okay. And for example, if they're implementing Cerner, they're going to hit a hiccup. You can't just sit down, they hit a hiccup, so it's going to affect our side of the business. That is, everything has to be part of the equation that, hey, things like this are going to happen and we should be prepared for it.
Right. So what's your plan to grow the non-government side of your business?
Okay, we are into a medical scribing business. Okay, we provide a total solution for the physician, that is providing them a physical scribe, dictation to text option, as well as a virtual scribes. Plus we provide a workflow assistance and help and the analytics. So that's the area we are going after. We hired a marketing guy to help us do a lot of inbound marketing. We are having a webinar about on the subject. We're having one webinar on 24th from Mass Health Data Consortium. Okay, so we are doing a lot of things on marketing and trying to capture that business.
All right. And in terms of getting your name out there, what's your plan on, are you using any outbound sort of marketing to let people know about your product and service?
We did a lot of inbound marketing. For example, we subscribe to HubSpot. One of my employee is a physician, and she writes a lot of papers which gets published in the national magazines like Becker Hospital Review, Physicians Advisor, and Healthcare Financial Management Association newsletters. So there's one piece we are doing. We are doing all those, sending out tons of emails, quarterly newsletters, webinars. We'll be having one. So those are the kind of things we are doing. Plus, we are doing a lot of local shows and having an exhibit. Exhibit hall or not exhibit table or exhibit booth at the local events. So that's what we are doing outbound as well as inbound.
Right. How about in terms of advertising?
We haven't gone into advertising. We just want to get this part done, okay, till end of Q3, and then we'll worry about advertising.
Right. How many people do you market to right now and through your email marketing?
We are targeting all the physicians, the large groups, greater than 10 physicians, small hospitals, large hospitals. Approximately, if you count about physician group practice, outpatient centers, okay, and plus all the community clinics, small hospitals, big hospitals, we are talking about 700 plus in the New England area.
Okay, 700 individuals.
Yep.
Now, when you say email marketing, are these cold email marketing that you're talking about, or are you talking about people who came to your site and signed up and now it's more of a...
That's a good question, Malcolm. We are doing a lot of cold marketing, and then we are having a lot of people who always ask for more. So it's a combination of both. But right now, 90% of it is cold marketing, sending out tons of emails. We had one campaign which was in May, another campaign which was in June. Now we're going to July. We took a time off because of the vacation time, July and August, and we're going to start another campaign beginning September.
Okay, so you're sending out emails to people who have never heard from you before.
Yep. Email is one way. We also send out, continue. Email is one way, yes.
Yeah, because the physician market's a very difficult market, from what I hear, right? Because, doctors are extremely busy, and two, it's a lucrative market as well. So, yes. And it's, from what I hear, people have difficulty getting traction. How's the traction working for you, and what are you doing that's allowing that to happen?
I agree with you. Getting the traction with a physician is extremely, extremely difficult. They understand what we are trying to do. It is something what they want, but getting the meetings, getting things started and everything, it's not that easy. We are working with a client as a 3-hospital network. We thought we got the project, but everything is on hold because of so many other factors. So it takes a lot longer. How do you get around it? You have to just keep on hitting and hitting and hitting. That's all.
Mm-hmm. All right. It's fantastic to hear that you're getting good results from your cold email marketing to the physicians.
Yep.
Now, do you do cold calling as well?
Well, we don't. We are going to start the cold calling beginning August. Okay, we have, and that's what we're going to start doing. Until now it has been email, so now we're going to start calling. My physician is going to start sending out emails to those physicians, because docs will reply automatically to a physician email than to my email. Okay,
right, makes sense.
We're going to have a cold calling by one person, but that is something which we are debating internally. If a person cold calls, is a physician going to take the call?
Right.
Because bottom line, physicians hate the salespeople.
Yeah. So when you go about initiating the cold calling process, how's that going to work? Are you going to hire someone who's had success cold calling physicians? Is that the route you're going to take, or will you perhaps experiment a little bit more, try different processes and offers before you find one that sticks, and then scale that up?
We right now I don't have an answer to your question, but these are the different options we are looking at it. We already have one person who will start doing the cold calling. Okay, we are also hiring one of those uh, cold calling companies.
Yep.
Okay, so that's the second option. The third option is I have a physician. Maybe she can call the physician, but the question is, physicians are busy from 7:30 to 4 o'clock in the afternoon, 4:35.
Yep.
So when's the right time to call that?
Yeah.
So, I mean, we don't have an answer to that. We are just evaluating it internally. I'm having a meeting with my marketing people next week, Monday, Tuesday. What's an option? Those are the three options we have. And we'll go with maybe a combination of all three or maybe part of it.
Yeah. Yeah. I actually had a conversation with a colleague, right? He kind of made a suggestion, about how I should just hire someone to do my cold calling. And I go, yeah, I could do that, but it seems like you need to have a process for them to follow, right? Otherwise, what are they going to do, right? Just start calling people at random.
We also we also had a meeting with one of the sales consulting companies, and they told us that what we do is we are talking to the physicians. Don't try to have a rookie or a small person who has never worked with the physicians cold call a doc. He says you will be shut out of that place forever. Because with a physician, it has to click in the first 10 seconds or 20 seconds.
Right. Yeah. People are pretty busy.
Yep.
I can hear that. I can totally understand that. So for next year, when things start picking up again, how does that work? Do you scale up your team as needed, or do you have the systems and processes in place that can handle the additional workflow that you see coming down the pipe?
Now, on the government side, we have the process and the people in place to handle, okay, up to 500 employees on the federal side, okay. On the non-government side, we have a process and people in place. I got burned in 2012 or 2013 when the government implemented ICD-10 medical coding. And when the government kept on delaying it, being a small company, I had to digest the cost and lay off the people, which is not a nice thing to do. So this time I spent a lot of money to do the process in place, just created totally a map, what we need, what we don't need. Hiring a lot of people who are independent. So when we need them, we call them. Otherwise, we don't call them. So that's the approach I'm taking. But I know that approach only lasts once I have a clear view that I'll be making 1 million on this side, then I can staff accordingly.
Mm-hmm.
Okay.
Yep.
So we are taking proceed with caution, but at the same time, we are aggressive too.
Right. To what degree can you automate the services that you provide?
We are automating so many things. For example, when we go, see the thing is, you cannot automate the services we provide because every physician, whether it's government or non-government, is different. Then the department they work, let's say internal medicine or ER or something, it's different because they all have a different workflow. Now the hospital they work for, they all are different because the hospital looks from each and every department, not just one department or one doc. So you try to it's like a Venn diagram and you try to find a common denominator or common place. So that's how it is. Once you start figuring out those things, then let's say for a couple of government hospitals, we are pretty consistent. So all the processes are same. So we just document the process. Otherwise, we take a middle of the road process and then we say, okay, you need to deviate from this, you need to deviate from this, you need to deviate from that.
Right. Got it. What sort of changes do you see coming down the line that you need to adjust for, or perhaps they offer a very attractive opportunity for you?
I mean, for us, we plan to continue in the same arena we are on the provider side. The kind of changes which is going to come is a lot of small hospitals are going to be absorbed by large ones. Okay, but as long because see, we work at the ground roots level. So if a doc is working for ABC hospital, which got acquired by XYZ, we got to know how the ABC is going to flow into the XYZ hospital. So those are the things which is going to be very difficult because, for example, in Austin, you might have an independent delivery network, which is like on a very powerful mode. So they might be in a monopoly mode or dual monopoly or whatever you call it. So those are the changes which is going to come. A lot of small ones are going to be taken away. The physicians, they are going to be much more like a value based. So they're going to be measured on outcomes. So all those things are changing, and you'll start seeing the effects, and we have to change along with that.
Right. Are there any huge changes coming that would require a radical change? Because I know healthcare is evolving all the time, right?
Yes. I mean, right now they're talking about so many changes coming. I'll give you an example. President Trump signed, I think he signed or is about to sign, I don't know, about a law where hospitals has to state how much it costs a patient for a particular treatment. So now the IT resources are all going to be diverted about putting those information on the web. Okay,
Right.
like let's say you go for a simple procedure. Oh, it's going to cost me $100. XYZ hospital is going to cost me $80. Things like that.
Yeah.
So now they have an electronic medical record which they have to support. They have all these other regulations which they have to support, like MIPS, MECRA, and now they have to support all these regulations which is going to come out. So they are already stretched. What is going to happen? Many of the small ones will many employees will quit because they don't want to work 70, 80 hours for every day. So those are the changes which is going to come in the next 1 to 2 years. And still, for example, if you're in a hospital and they treat you for a particular disease with a particular medication, they got to state how much it is going to be paid for.
Right.
Okay, so all this changes, and when you have a limited amount of IT people and all those people, what are they going to concentrate on? Supporting the electronic medical records, supporting the regulations and the requirements, as well as at the same time to support the new requirements.
Yep.
Okay, and then you have all the physicians who are complaining that they are getting burnt out because they're working like 15, 16, 17 hours a day.
Yep.
So those are the changes which is going to come, and we have to be ready and how to work with them so that it's less, bottom line, less burnout for the physician, less burnout for the people in the IT and other support services to support everything.
Right. Do you think it's going to happen? The price transparency and be able to compare services more easily?
It could happen. We don't know.
Yeah, and because a lot of people don't want it to happen, right?
But there are two sides to the coin. One side will say, hey, for a simple appendicitis, it cost me $4,000. Over there is, why is it costing me $7,000?
Yep.
People will start questioning. So, think about it in your own company. Health insurance is growing at the rate of 5% to 10% per year. Is the income increasing by 5 to 10% per year? Ask yourself a question.
Right.
So let's see what happens at Washington. I cannot predict, and I don't know what will happen.
Yeah, for sure, people would appreciate the price transparency, but boy, there's a lot of vested interests would not want to have that happen as well. So, all right. Now, in terms of the structure of your business, do you see a lot of consolidation going to happen in terms of your industry and the services you provide?
Yes, because let's say we are into XYZ, we are about so many people. Of course, efficiency, effectiveness, and all those things are going to play much more because the customer side or the provider market or the healthcare market is changing. So maybe bigger the better, or maybe small ones are better. I don't know, but things will change. I don't know in which direction.
Do you see the consolidation occurring simply as a bigger is better sort of concept, or do you think you might be acquired, or you might acquire someone else that might be in a different part of the supply chain and complementing it from that perspective?
I mean, I'll give you a very simple example. Based on our previous conversation, you said you lived in Providence. Let's say we work at Providence Hospital. Okay. We are doing a couple of things. We are doing medical coding, medical auditing. But what we are not doing is other health insurance. Okay. And there is a company out over there which does other health insurance for a patient. Combining the two will help Providence Hospital much more than dealing with two different vendors. Okay.
Right.
So those are the advantages. As far as us are concerned, I'm going to keep myself open to all the different directions. I don't know. Okay. But if it makes sense for the customer side, sense for my employees, and sense for everybody else, who knows?
Right. Yeah, I guess as the government being a big important player in the healthcare industry, and yet not really knowing how things will unfold, it does make it hard to foresee the future.
Yep. So we will see.
Yep. 3 last questions for you, Paresh. What message would you show on a billboard along the freeway that's only going to be seen for 6 seconds or less?
Let me explain to you. Long time ago, I was talking to a physician. And I mean, this is like about 12 years ago. And I was talking and he had asked me, what do you do? I was at a physician meeting. Okay. And I explained to him, we do compliance and, it was a kind of a long 5 or 6 sentences. So the physician kind of told me, you basically screw docs like me.
Why would he say that?
No, because he says, I don't have time and you guys are coming up with all those things. And so you basically screw me. So it got me thinking, okay, then why is the physician telling me that?
Yeah, it seems like you help them, not screw them over.
So what I do, if I have a 6-second billboard message, this is my physician billboard. My message is very simple. We work with physicians or providers so they do not get screwed by all these regulations and requirements.
Right.
Okay. So I changed around what the physician had told me and used that as a billboard message.
Right. Now, why did that physician think that you in particular, or your business in particular, would screw them? I don't see the connection there.
Yes, I sat down with him and I talked to him. He told me he leaves his house at 6:30 in the morning. He starts seeing the patients at 7:30 till 4:30. When he sees a patient, he has to do so much documentation on the electronic medical record. He has to follow so many rules and regulations about HIPAA and other stuff. Then he has to follow the rules and regulations for MIPS and MECRA about how they are going to be measured. And then at the end of the day, he has to make sure that his notes are clear so that people from billing, coding can easily do coding and start billing the insurance companies. He says, by the time he is done, it's about 8. He goes home at 5. And this is not one physician. I'm talking about a lot of internal medicine physicians I did a survey on. They go home 7:30. Again, they start doing documentation for 2 hours. That's a lot of work, my friend.
Yeah.
14, 15 hours every day.
Right.
And what has happened because of that, the physicians are getting burnt out. Just think yourself that you are sick and you go to a physician. Do you want to be treated by a physician who is burnt out?
No, of course not.
That's what it is.
Yep. All right. Got it. Last 2 questions for you. Who are your ideal clients and what's the best way for them to contact your company?
My ideal clients are basically larger departmental groups like emergency room, emergency medicine physicians at XYZ hospital, internal medicine over there, or treatment facilities. Those are the small ones, less than 150 beds or something, or usually they're outpatient. Those are my ideal contacts or clients. And the best way for them to contact me, usually docs will always call by phone or send out an email at the end of the day, but also to be in touch with the CFO in those places.
Right. Got it. Paresh, it's been awesome having you on my show today. Really enjoyed hearing about how you grew your business and how you navigated last year and your plans for the future.
Okay, thank you, Mike. I want to wish you all the best.
We've been speaking with Paresh Shah, the president of MindLeaf Technologies, about its company's rapid growth. For interviews with other fast-growing, high-value sales companies, or to learn how we can accelerate your firm's high-value sales through automation, visit eversprint.com.